My name is Marissa Luce, and I'm very honored to be introducing this next slate of speakers. These, in my opinion, are freedom fighters in the Black maternal health movement. And we're going to first kick it off with Dr. Ndidiamaka Amutah-Onukagha. And Dr. Didi is just amazing, and you all will experience that very soon. She received her PhD in public health with a focus on maternal and child health at the University of Maryland College Park School of Public Health in 2010. She received her master's in public health from the George Washington University School of Public Health and the Health Services in Maternal Health and Child Health in 2005. Her dissertation focused on infant mortality in Washington, D.C., and it specifically examined neighborhood level disadvantage, social determinants of health, and race and equity as predictors of infant mortality. Dr. Amutah-Onukagha also received her BS in public health and BA in Africana Studies from Rutgers, the State University of New Jersey. Currently, Dr. Amutah-Onukagha is an associate professor at Tufts University in the Department of Public Health and Community Medicine. In this capacity, her research focuses on adverse birth outcomes for women of color, HIV/AIDS, and women of color in an urban context, and community-based participatory research. She's also the visionary behind a Black maternal health conference that happens here for the last few years, and also the visionary behind Black Maternal Health Advisory Council. Without further ado, Dr. Didi.
Good afternoon, my people. Good afternoon, my people. It's a pleasure to be here. It's a pleasure. The pleasure is mine. I just want to say a few remarks about, first of all, shout out to the March Like a Mother crew. Like, pulling this together in such a short time is no easy feat. So, good afternoon. I bring you greetings. And for me, I want to tell just the tale of two people in one. So, as you guys heard, my 9 to 5, I'm an associate professor at Tufts University School of Medicine. I host a conference on Black maternal health every April during Black Maternal Health Week. But really, I'm a revolutionary that just happens to be housed in the academy. And my goal is to take the resources of these institutions to the academy. So, I've been in Boston for a few years now, and I think for me, what I'm noticing here in Massachusetts is there's tremendous opportunity to address the systematic and systemic racism and oppression of Black and Brown people. And one thing I will say, in a place like Boston, that's a healthcare mecca, we see so many resources, we see tremendous facilities and tremendous opportunity. We know that Black and Brown women are still being marginalized, still being mistreated, still being discriminated against in labor and delivery when they go into the hospitals. And for me, it really has been quite humbling and quite surreal, but also very reaffirming. As a new mother myself, I have a 14-month-old toddler. He's beautiful. Shout out to my husband over there, honey wave. And so, for me, as someone that studies maternal mortality, morbidity, someone that's committed to doing this work, in my own labor and delivery experience, there definitely was, shall we say, some missteps, some missed opportunities. And so for me, I just feel a very urgent need to dismantle this system. Massachusetts often rests on its laurels as a place that has so many resources, but when you really look at the data and you look at the rates by race, we know that Black and Brown women are still being mistreated, and we know that overall, the United States is failing horribly at addressing maternal mortality in communities of color. So the relationship between systemic racism, poor birth outcomes, and adverse outcomes for women, it's not happenstance. We know that communities of color are targeted and disenfranchised, and we know that there's not enough of us in senior leadership in these spaces and in these rooms where these decisions are being made. And so I would just urge all of you to officials accountable, make sure that people are doing what they say they're going to do. If you go into a clinical encounter and something doesn't feel right, shout out to my pregnant and parenting moms out there. This is the opportunity for you to say, you know what? this doesn't sound like what I need to be doing. If I'm not feeling this OB, this nurse practitioner, this midwife, this receptionist, whoever it is, then that's where you think about shifting your change and shifting where you're going to deliver and where you're going to get your care. These institutions are beholden to us. They are here to serve us. This is not a luxury. This is what they were trained for. This is what they went to school for. This is what they took the Hippocratic Oath for, to make sure that Black and brown women are not mistreated. And so I would just urge all of us to use our collective voices. I believe in the power of the written word, op-eds, events like this, QI boards, write letters to the president. Everyone is being held accountable. So we have to work together to dismantle these systems. We have to reduce these rates. Black women are 243%, y'all, more likely to die than their white counterparts. If that doesn't just blow your mind every day, I don't know what else will. And, I think I'm so grateful for this gathering, because I think the audacity of hope is still there, right? Even when we see what's happening, say their names: Breonna Taylor, Elijah McDade, Sandra Bland, George Floyd, and so many others. And I think for me, this is the beginning of an opportunity. This is building on what's already been there, but it's also a chance for us to step up as a community together and address these things. So from wherever you sit, in the community, in the academy, in the hospital, in all these institutions, we need to do a better job collectively of addressing these things. So thank you all. I will definitely be around if anybody else wants to talk, but I just wanted to give a shout out to the organizers and all of you for joining us here today, and thank you so much.